dressing change, the patient's going to have a dressing change. A dressing already on their abdomen. So wash your hands, put regular gloves on, and then you're going to take that dressing off. So your dressing change kits do not have sterile gloves in them, so you will need to get sterile gloves. The other thing that you will need is your solution, whether it's saline or if you have an order from a physician that has a specific solution that you're supposed to use. What this dressing change is going to teach you is like a wet, what we call a wet to dry sterile dressing. What we're doing in that dressing change is keeping the bed of the wound moist so that granulation happens, okay? So one of the things that you need to do before you get started is going ahead and open your container, and you would get your supplies out, but before you put your sterile gloves on, you want to pour your solution that you're going to put your gauze in this tray first before. Now, if a container is open, you will lip the container. Do you know what I'm talking about when I say lipping the container? Okay. Yeah. When you're lipping a container that's already been opened, basically what you're doing is you are taking the solution and all the way around the area so that it's as clean, sterile as possible, okay? Put the top up. So you want to open this up, and I've got clean gloves on, okay? This is your little red bag trash can. Now this does not necessarily have to go in the red trash if you don't have a lot of blood on your dressing, okay? So you've got a bag to throw everything away in. So you want that bag to be down here close to where you are. Now, my hands are still clean. What you can do is go ahead with your clean gloves on and remove this dressing. Take out the packing. We're just going to fold it and throw it away. Then I would take off my clean gloves, wash my hands, and then get ready for my sterile field. So you can do this part. Remember when we were talking about Foley catheter, and then I said, you know, with clean gloves on, you can put the pad underneath the patient. You can do this the same way. You can either do that or once you get your sterile gloves on. So I like to do it personally before. So remember, it's the 1-inch border is what you can touch. The rest of it is your sterile field. So you want it to fall open, and you want to lay it in an area that is close to where you're going to do your dressing change. Remember, you reach around a sterile field just so that you can put everything on. So what I do is take my tray and dump everything out. Then I've got my tray to put my solution in, and I'm just going to put a little bit in there. Okay, so now all my stuff is here, and I'm ready to put my sterile gloves on.
Logan, do you think you need to stop it and do 2 of them so you can send it not too long?
I can, yes.